anemia. So the description and phenotype of sickle cell is that it is a hereditary blood disorder. It's caused by a mutation in the HBB gene, and that's responsible for like encoding the beta globin subunit of hemoglobin. And hemoglobin is the protein in the red blood cells that carries oxygen throughout the body. So if you have a mutation in it, you're going to have an abnormal form of hemoglobin, and that's known as HBS. And so if you have under low oxygen conditions, HBS will cause the red blood cells to turn into like a sickle shape rather than a typical round flexible shape. And so this can lead to impairments in the oxygen delivery because the misshapen cells have reduced flexibility, and then that can make it less able to pass through small blood vessels. And some of the clinical symptoms is that you can have vaso-occlusive pain. So this is when you have blocked blood vessels, and then that can lead to like severe pain, known as the vaso-occlusive. And then these episodes are generally a hallmark of a disease, and it can last from like hours to days. Then you can have chronic anemia or jaundice. So this is when the body breaks down the red blood cells and it releases excess bilirubin, and your skin will start to become more yellowish of the tone. And then generally, this disease will also cause chronic anemia to reduce oxygen and nutrients in growing tissues. So you can have stunted growth and development in children. And then finally, research shows that there can be organ damage as well. So the frequency is that its most common populations have been studied to be in African, Mediterranean, Middle Eastern, and Indian descent. Of course, it can affect everybody, but this is generally the populations that were discovered to be most prevalent amongst. This is important because if you look at the statistics, approximately 1 in 365 African American births in the US will have this genetic disorder, and then 1 in 13 African Americans can carry the individual trait with the sickle cell disorder. And so globally, you could see that there is an estimated, about 300,000 infants are born with this sickle cell anemia. And then this can be primarily in the sub-Saharan Africa, Indian, and Middle Eastern area based on the research. And then approximately 386,000 new cases of sickle cell diseases occur annually worldwide, which is a pretty large amount. Um, and yeah, so the genotype we'll look at is that the most commonly formed is SCD, and that's the mutation of the HBB gene. So the individuals which inherits two sickle cell trait genes, one from each parent, this is going to be more of an exclusive production of the hemoglobin S. And so the impact of this is that they're clumped together under low oxygen conditions, and then that will cause the red blood cells to sickle. And it will show the more observant clinical symptoms and complications of sickle cell disease. There are other variations of it, like HBSC, and this occurs when the individual only inherits one sickle cell gene and the HBS, and then one gene for the hemoglobin C or HBC. Hemoglobin C is another abnormal variant of just hemoglobin, but it will cause less severe symptoms than HBS. So each of these will have different variations with one another. And then clinical presentations of this, generally, as I mentioned, are less severe. So you might have mild anemia or just like occasional vaso-occlusive crises. And then the final one that I put down, there is HBS beta thalassemia. This results from if you have one sickle cell gene, HBS, and one gene for beta thalassemia. Beta thalassemia is a condition where there's reduced or absent production of normal beta globin chains. And then the subtypes, you have beta 0, so no beta globin is produced. So you have severe presentations similar to HBSS, or you have like the beta plus, so it's just a reduced form of the beta globin. So you'll have milder symptoms. But again, these all show that the severity are going to depend on the symptoms of whether the individual has like beta alpha or beta 0 or beta plus. And so the complications can be like the ones I mentioned before, anemia, vaso-occlusive pain, or like organ damage, depending on the particular type of gene.
Sickle cell disease is classified as a group of inherited red blood cell disorders that results when a child receives two abnormal hemoglobin genes, one copy from each parent. In other words, for a person to develop the disease, a mutation needs to be present on each of the two genes, the corresponding chromosomes inherited from each parent, in what is referred to as a homozygous state. It is inherited in an autosomal recessive manner, and carriers or those with sickle cell trait do not typically display symptoms, but they may experience mild symptoms under stress, such as low oxygen situations like high latitudes or scuba diving. The exact location of the mutation is on chromosome 11, positioned on the P arm near the telomere at band 15 and subband 5. Next slide, please. So the disease is the result of a point mutation consisting of a single nucleotide change in the hemoglobin beta gene. The hemoglobin beta gene is responsible for encoding beta globin, the beta subunit of hemoglobin, which is critical to the survival of is a critical survival protein that transports oxygen to all the tissues in the body. The mutation occurs at the 6th codon with an adenine to a thymine substitution. This results in a mature protein changing from glutamine to valine. Sickle cell hemoglobin contains 2 alpha globins and then 2 of the mutated beta S globins. And upon deoxygenation, the presence of the hydrophobic valine residue on the mutated form causes the molecules to polymerize, leading to stiffening of the red blood cell, making it very difficult to carry oxygen, as well as shortening the lifespan of the cell itself. Next slide.
Hi. So for the histology, this mutation results in blood cells that are sickle-shaped, as we mentioned before, rather than round. And because of this, there's less volume in the cells to carry oxygen throughout the body for the patient. And then also, as we've mentioned before, I'll digress. The healthy round blood cells will flow through blood vessels with ease. They don't get stuck to each other because they're round. However, the sickle cell shaped cells can get caught in the bloodstream. They can literally get caught up with each other and stuck, which further exacerbates the patient's ability to get enough oxygen as well as nutrients from their blood. And also, as my colleagues here mentioned, the sickle cells don't live as long as normal blood cells. These sickle cells only live for like 10 to 20 days, and healthy round blood cells live for 90 to 120 days, meaning that this is another tax on the patient's body and further exacerbates the anemia. Next slide. So, as we've indicated before, the sickle cell inheritance is autosomal recessive. So as we see in this chart here, if you have 2 parents that are carriers, they may have absolutely no symptoms of sickle cell. They may not even know that they're carriers unless they've been tested. If they are both carriers, they can go on to, hypothetically, if they have 4 children, statistically, they would produce, odds go this way, 1 child that doesn't carry either, doesn't inherit this gene from either parent, they're totally fine, no sickle cell, and normal hemoglobin, and then 2 kids that are similar to themselves, each get 1 copy of the gene, but not 2. So it's recessive. They have no presentation, and but they're carriers. And then the other child, sadly, statistically, would come down with sickle cell anemia. So that's how this would roll out in a pedigree. Next slide. So in terms of treatments and therapies, historically, there's been pain management. There wasn't much that could be done as far as a cure until very recently. And the pain management are specialized drugs like hydroxyurea, L-glutamine oral powder, and crizanlizumab. Sorry, I don't know how to pronounce that very well. And then also to treat anemia, there's a drug called voxelotor. Surgical treatments include blood transfusions to give people healthy blood cells, bone marrow transplants to hopefully stimulate the production of healthier blood cells, and stem cell therapy. And then very recently, the last couple of years, there's been a lot of promise. I think it's FDA approved at this point, is gene editing therapy with CRISPR. So basically the patients can get their genes edited. They can get this snipped out. However, there's no complete cure for it because you're still a carrier as far as your genetic material. So it doesn't stop the patient from passing it on to copy of the genes onto their children. And another disadvantage, or I don't say disadvantage, but lack of a complete solution with CRISPR is that they don't really know the effect of CRISPR therapy on eggs and sperm. So what they tell patients is either to start the process after they've had the children they plan to have, or to bank their genetic materials, their egg and sperm, so that they're not affected by the treatment because they just don't know what it would do to those cells. But it's very promising. and hopefully there is a good future for people struggling with sickle cell. Next slide.